60-year female, 60 years female, outpatient unilateral form facial swelling, swelling on the face, right earlobe. So earlobe is raised, means it is something related with the parotid. So now, what is the most probable diagnosis? It is parotid adenoma of the parotid gland. What is most common benign parotid tumor is pleomorphic adenoma. What is differential diagnosis of unilateral swelling of the parotid gland? So what can be the different unilateral parotid swelling? It can be obstruction, salivary calculus due to calculus, or it can be infection, or it can be malignancy, neoplasm, benign or malignant. What do you mean by pleomorphic? Pleomorphic. So it has got different size and shape and stains of nuclei. Pleomorphic appearance, benign tumor consists of mixed ductal. So it is mixed epithelial, myoepithelial, therefore it has got mesenchymal differentiation. Can it turn to malignancy? Benign to malignancy, 5% of the chances. How does it occur? Standing pleomorphic, average recurrence 20 years. It may take up to 20 years. So what is the most common malignant tumor is mucoepidermoid cancer is the most common. From an examination, signs suspect malignancy. So what are the signs which you suspect malignancy? It can be facial nerve involvement, irregular, heart shape, fixed skin, ulceration, lymph nodes if they are enlarged. Characters of malignancy in general. Anything in general, anaplasia, tumor invasion. Simple test is FNAC. You do FNAC. Certainly raise concerns of malignancy. What are certainly figure that are concerns? So it can necrosis, atypical mitosis, polymorphic size and shape, hyperchromatism, and mitotic figures. Main difference, what is difference between cytology and histology? Cytology and histology. Cytology is the science study of the cells, it is the tissues. So it is cheaper, it is costlier, it is simple and easy to take, but there are disadvantages that you cannot get proper cells. So if you see FNAC findings, some of the Langerhans giant cells are seen, it is Mycobacterium tuberculosis. If you get brown pigmented cells, then it is melanoma. If it is Reed-Sternberg cells, you think of Hodgkin's lymphoma. So FNAC has got, for example, if FNAC, what is sensitivity and specificity? If FNAC is 81% sensitive and 98% specific, so what you can think is 19% of the cases will be having. So sensitivity is ability to detect with the disease, so true positive. So high sensitivity means false negative. So false negative can be 19%. And specificity is ability to detect disease free. So disease free. So false negative is, so true negative. It is giving true negative, the sensitivity false negative, specificity is true negative. So less chances of false positive. How can you differentiate between carcinoma and lymphoma? Carcinoma is epithelial cell lymphocyte, it is done to run immunohistochemistry. Then simple words, localizing specific antigen antibody reaction. How it is done? Antibody is usually linked to the enzyme fluorescent dye, antigen antibody reaction. Antigen is linked to fluorescent dye, and it is mixed with the antibodies, and then these are detected under microscope. So how to rule out malignancy intraoperatively? Intraop, you do fusion section. The tissues are taken and is sent for the histopathology tested, and the report comes on the table. So what are the post-operative complications of parotidectomy? Parotidectomy is done. What are post-op? complications that can happen. It can be seventh nerve palsy, auriculotemporal nerve injury, Frey's syndrome, salivary fistula, greater nerve damage. What is Frey's syndrome? So Frey's syndrome is damage to auriculotemporal nerve. These are sympathetic supply to the sweat glands. So what happens? Resulting gustatory sweating, facial sweating due to re-innervation of post-ganglion fibers to sweat glands. 10 years of patient present with neck swelling, this recurrence. Now, a 55-year female has gone on mastectomy and then develops pleomorphic adenoma. What is breast is considered a benign modified sweat gland sharing with the salivary gland, some morphic features. So, breast cancer and salivary gland expression gene, breast cancer and salivary gland expression gene, base genes. So, this is our BRCA, BRCA1 and 2. So, these can be genes which can found. So again, FNAC and true cut biopsy is done. True cut is histopathology. FNAC is fine cytology. Test can be done is immunohistochemistry. Check the receptor status, estrogen and positive. Estrogen, ER, progesterone receptors, and HER receptors. So these are the receptor studies which has to be done. Cytology is inconclusive, means poor technique, inadequate sample, or it can be FNA sample is considered adequate. Maximum 3 free preserved cell groups to slide, no fixation, have a defect in tennis players. What is the meaning of pleomorphic? Again, so metastatics erode the carotid artery, then how to do carotid blood syndrome can be there because of infection, and that wall is 5 steps. Metastasis occur. It can be from the direct mets, so it can be direct, or it can lead to penetration of lymphatics, vessels and all that. It can transport tumor cells in circulation and arrest into the capillary bed. Cancer cells have epithelial growth factors, lymphatic and cells, so that spreads. So these are about the pleomorphic adenoma and different. For breast cancer 5 years ago, as well as one parotid 10 years ago, present superclinic lymph node. So tissue biopsy, true cut. So tissue biopsy is done, true cut, FNS biopsy. What are the investigations? These are the tissues, and imaging is MRI, ultrasound on the opposite side. What has to be done? You do FNAC, cytology or immunohistochemistry. You can do fish fluorescent, in situ hybridization, then hormone receptors, ER, PR, HER, two receptor studies. So what is the ER important? It helps in prognosis, and then treatment strategy, HER transfer into human epidermal growth factor. So human epidermal growth factor, HER receptor 2, oncogene biomarker overacts 15% of the cases. The difference between histology and cytology. What is, when you do cytology, so there are different things, C1, C2, C3, C4, C5. So what does C1 up to C1 to 3, what you see is that inadequate sample, definitely benign. This can be equivocal. Then you go for this is malignant and this is suspicious. Adenocarcinoma. So what is adenocarcinoma? It is a glandular epithelial cells. What is the relation between pleomorphic and breast carcinoma? Hormonal therapy to give pre and post menopausal. In pre, you give tamoxifen. If you post, you give aromatase inhibitors, anastrozole, and all that. Patient around the nipple, there is a around the nipple. If there is, you get that is eczema or Paget's disease. So what is the pathophysiology of Paget's? About Paget's, what is that? You get it is extension of the ductal carcinoma in situ. So up to lacteal line contiguous with the skin, it goes with the skin. So ductal carcinoma in situ unilateral causes. Genes again PDA, pituitary growth factor and TGs. So most of the time, mellitus Chinese. So patient is Chinese and he has got ulcer in nasopharynx. So this is simple nasopharyngeal carcinoma. So pathology you have to go for. Explain more steps. What is the frozen section? Then the steps of frozen section. Then if you describe surgery in waiting, what are different factors, risk factors in nasopharyngeal carcinoma? So it can be modifiable, non-modifiable, modifiable. So this is diet, salt, and fish and all that, and the carcinoma. Then what are the non-epithelial lymphoma, rhabdomyosarcoma, sarcoma? Then again the difference between cytology and pathology, histopathology. What is immunohistochemistry? Immunohistochemistry. So here the important thing is cytokeratin. The marker is explained in squamous cell carcinoma but not in adenocarcinoma. P63 and P40 commonly expressed in squamous cell carcinoma. So cancer cells, how does spread, which are different, and what can be the fungal infection, candida infection can occur. Female, foreign travel, cervical lymphadenopathy. Weight loss, night sweats. So this picture is directing towards tuberculosis. Now the station is, what are two different types of differentials is, DDs can be Hodgkin's or tuberculosis. Why do you suspect which type of lymphoma? Hodgkin's. Then which lab you sent for? Microbiology plus cytology. So what you do, two rapid tests. So how tuberculosis is diagnosed? So the test is recombinant. So recombinant polymerase amplification. Polymerase amplification. So RPA, this is recombinant polymer, or quantiferon. So this is another test, interferon gamma assay, or polymerase chain reaction, PCR. What will you do with the specimen? This is biohazard. So it has to be disposed in red color and labeled as BUN3373. So biohazard. So organisms in tuberculosis are Mycobacterium tuberculosis, Mycobacterium bovis, Mycobacterium avium cellularis. What are the stains which are used commonly? Zeal-Nelson stain, Oromain gold stain. So Mycobacterium is found in which in immunocompromised. Patient is immunocompromised. Which is found here? It is avium intra Mycobacterium MAC. MAC. So how long it takes for culture? 6 to 12 weeks. You have to wait for 6 to 12 weeks. What is your diagnosis? Necrotic tissue, granuloma, and tuberculosis. What type of proteins is? Again AA protein, TB. So what are the multinuclear Langerhans giant cells? Surgically relevant examples of granuloma. What are the examples of granuloma? So it can be fungal, it can be aspergillosis, it can be sarcoidosis, it can be Crohn's granuloma, rheumatoid arthritis, foreign body, tuberculosis, and leprosy. Tuberculosis, person is diagnosed, a lady is diagnosed with TB. What will be the next step? So patient needs to isolate, inform, notify, communicable disease control health agencies. Anti-tuberculosis drugs has to be started. Then contact tracing, 25 days, since last 25 days.